Radnor Township Board of Health will come to order. This is our first meeting of 2012, and I'd like to wish everyone a happy and prosperous and healthy new year. And please join me in pledging allegiance to our flag. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. At this time, we'll take a minute to review the minutes, which were sent via email in your packets. And I'll entertain a motion to approve the minutes as submitted.
So moved.
Is there a second?
Second.
Thank you. Any discussion, any changes, deletions, corrections, etc.? Hearing none, all in favor of approving the minutes as submitted, say aye.
Aye.
Any contraries? Okay, the minutes are approved as submitted. As has been the case with every January, the Radnor Township Board of Health conducts elections for the president and vice president of the board. And at this time, I will relinquish the chair of the board to Amy Wishner, who is the vice president, in order that we may conduct nominations and elections for president. Thank you.
So I will entertain nominations for president, and I will start by nominating Herb Hazen for president.
I'll second that.
Are there other nominations for president? Don't be afraid of hurting his feelings. All right. Well, I'm sorry?
Great.
It'd be great.
Great.
So hearing none, all those in favor of Herb Hazen for president, please say aye.
Aye.
And any opposed? Abstentions? It is unanimous. Congratulations, Herb.
Thank you. Thank you for that vote of confidence, and or perhaps it's just that no one else has the time. I'll put it as kindly as possible. At any rate, I really appreciate that, and I'm looking forward with great enthusiasm to another good year for the Radnor Township Board of Health. We've accomplished a lot in the last couple of years, especially in terms of providing public education.
So let me just say something, and I should have said more rather than leaving you with the impression that it is people's lack of time, because I feel like you've done a really great job as president. You're here, you're organized, you keep us on track, you bring things up in terms of what's, what it's time to do, coming up with goals, doing the elections. And you've also gone to other meetings, such as those in media when the Johns Hopkins report was published about the need for a public health department, and you've shown really terrific leadership. So I don't want you to think that it is just because you're a warm body. So
That too has been open to question, but thank you for that, Amy. And with that, at this time, I will entertain nominations for the post of vice president of the board. Dr. Donato.
I'll nominate Amy Wishner.
Any second to that nomination?
I'll second that.
Thank you. Any other nominations? Well, Hearing none, then I will ask for a vote. All those in favor of Amy Wishner serving another, the year of 2012 as Vice President of our Board of Health, say aye.
Aye.
Aye. Any opposed? Any abstentions? None? Okay, congratulations, Amy, and let me also say that, return the compliment. It's great to have someone with your background in immunizations and other childhood health issues serving on this board, because that's an important part of what we do, and you bring an enthusiasm, and you keep up to date on a lot of the issues and keep us informed on what's going on. So great. I'm glad that you are going to remain as the vice president here. At this point, with regard to announcements, and I'll combine items 5 and 6, the health officer's report, because Larry Taltone, the township health officer, is at a meeting in media tonight of the Delaware County Council, at which an update on the progress made so far on implementing the recommendations of the Johns Hopkins University with regard to improving the health status of Delaware County's citizens is being presented by Dr. George Avedian, the senior medical advisor to the Delaware County Council. And a particular target of that report are all of the municipal and township health officers in our county. And we thought it was important that Mr. Taltone be there this evening. And he will, as he indicated in an email, report back to us thoroughly, I'm sure, at our meeting in February. That said, I have been in touch with Dr. Avedian, and Dr. Avedian is willing to come to one of our upcoming meetings and present the report that he's giving tonight in media. And the only problem is I will have to get back to him. We had discussed the February meeting, and I had neglected to mention to Dr. Avedian that the meeting is scheduled for Tuesday because of President's Day being Monday. So I have to make certain that he can actually do it on a Tuesday. So I will do that and get back to all of you with regard to that. If he can't do it in February, then I'm sure he'll be able to do it in March. Okay. Any questions about that or comments? And I should note that Mr. John Nagel of the Township's Board of Commissioners is with us this evening as liaison from that board. Usually John Fisher has been here, but he is not here with us tonight, so Mr. Nagel has been good enough to come. And Mr. Nagel, I should extend an invitation to as many, through you, to as many members of the Board of Commissioners as wish to come to Dr. Avedian's presentation, because I think it's important for them to hear what progress has been made on that issue as well. You'll recall the township, the Board of Commissioners co-signed a letter to the Delaware County Council urging not only implementation of the Johns Hopkins report, but urging going beyond that to the implementation of a formation, rather, of a county-wide Department of Health. And while they are not at that point yet, nevertheless, they are making progress on the Hopkins study. So I will get back to you via email and let you know whether it's February's ago or whether it's going to be March.
I'll be glad to share that with them. Also, I'd be interested in the opinion of this board about the progress that's being made independently. Dr. Vidian lives in my ward.
Yeah, I know.
He's on Wooten.
He and I have met several times, one of which was in his home, so, yeah. I think we need to hear the progress before we, and we will certainly want to report back to the Board of Commissioners on that, and I thank you for that invitation. At this point, I want to move to old business, and Kelly Doyle, a member of the Board of Health, who represents us on the Environmental Advisory Council, is suddenly unable to be with us this evening. She did take the time to email, and I think we all got it, a summary of the EAC meeting that she attended, and I would encourage everyone to read that summary. And we can raise any questions with Ms. Doyle at our next meeting. The other item on old business.
So I don't know if people had a chance to look at that. I mean, my reading of it was that first of all, well, it didn't look at residential. It was looking at the sort of businesses and facilities in the township, and of those, it looked to me like the schools was the biggest. The Radnor Township Public Schools was the biggest sort of contributor, and among that, the vehicles, the buses. And I have seen things just in the press about school districts starting to get electric buses, and because it's a national issue that school buses are a big contributor to pollution. And I just wondered if, people had any thoughts about that, or anything else to contribute to that.
Before we do that, I should mention that what you're referencing is the report that the EAC prepared and sent to the Board of Commissioners regarding greenhouse gas emissions in Radnor Township. Thank you.
I guess just the only other thing I'll add is my personal pet peeve about the on-ramp lights to the Blue Route, which force you to stop, which seems like, of course, it adds to pollution rather than a smoothly entering onto the Blue Route, which I just really don't get as a traffic calming. It seems like, yes, you're calming traffic, but you, of course, are increasing. I mean, that's like the exact opposite of what you want to do to decrease greenhouse gases, is force additional traffic stops. So it's not so much as a personal inconvenience, which is really minor and actually doesn't particularly bother me. It's just as a pollution thing, I just really don't get it. But I guess wiser minds than me have come up with that. But
Well, before we leave the question of buses, though, Mr. Kane is here this evening representing the Radnor Township School District. And again, welcome, Mr. Kane. I think it's absolutely marvelous that the school district is providing your presence at these meetings, because I think that's something that we've been missing. I know it's not within your it's not part of, school buses are not part of your portfolio, but maybe, I don't know if you know anything about any plans that the school district has, or can find out anything for us for the next meeting with regard to that.
I can certainly speak with Mr. Blackburn, who's our Director of Transportation, regarding his long-range planning in that regard. Also, around our schools, as parents are dropping off students, you may see a sign that talks about no idling. And that came forth from legislation from the Department of Transportation maybe 3-4 years ago, which requires buses to stop and turn off as they're waiting for students. Thereby decreasing the amount of greenhouse gases or fluorocarbons that are around students as they exit the buildings. I don't know particularly any plans in the future for green buses. I mean, certainly that might be something to take a look at. I know they're somewhat costly, and I know each year we do strive to increase or update our bus fleet as certain buses are becoming less than ideal in their economy. So it's something I can ask about and report back, but thankfully that is not under my purview. But I will find that information out for you.
Thank you. At this point, we want to resume our discussion under the heading of teen health issues, and I'll
Herb,
ask-
just before we get to that, I just wanted to say something about the Bus Eiling Ordinance, because we were and for those on the Board of Health who were newer, we were part of the reason that happened, because we, many of us on the board noticed and were frustrated by the bus idling at Villanova University, at Eastern, and at the high school in particular. And that sort of spurred us on to communicate that through the appropriate channels to the State Department of Transportation. And that was part of the reason that legislation got passed. So good for us.
Good for you.
I want to move on then to teen health issues, and I'll ask Dr. Leader to begin us on that discussion. Thank you.
Sure, just some carryover from our last meeting with working with Amy Wishner and Alexa on the project of obesity, raising awareness about obesity in Radnor Township. I had emailed with Alexa heading into the Christmas break to give her some pointers on next steps and things she could do about talking to students about what they drink, what drinks they drink the most, and which ones would they'd be most surprised to hear have high numbers of calories, and then we could pinpoint something for her poster. So anxious to hear back on her student survey results and what she found.
Well, so I asked around school, like, what do you like to drink, and, like, that kind of stuff. And, like, surprisingly, they were mostly generic drinks, like orange juice, apple juice, and, like, sodas, root beer, Coca-Cola, Sprite, Izzy, and then Starbucks drinks, which were, like, caramel macchiato, cafe mocha, peppermint white chocolate mocha, and vanilla bean cream frappuccino. So, yeah, it's a mouthful, But so I found all of the calories for like certain sizes of these drinks, and then I calculated like how long it would take to walk to burn them off. So I have all of the information together. It's just a matter of like putting it on a map. So, yeah.
So I understand for Google Earth that the appropriate thing is for us to contact them actually and ask their permission, and which I have every expectation they would give us and wouldn't charge us for it, and they might also provide us with high resolution photos. So it would, and I don't know, yeah.
I think Mr. Doling is back behind there, but I'm not sure. But I think we were emailing. I'm not sure. Were you in on that exchange in December where he said he also had access to Radnor Township maps? Maybe we wouldn't, I don't know. Maybe we wouldn't have to go through Google, but we could see. And he was also saying that he might have expertise in helping, like if we gave the route, he would help design it a little bit. But go ahead.
Okay.
I just wanted to.
Excellent. Yeah, excellent.
I don't know. Are you listening, Mr. Doling? I don't know if he hears us from this side of the wall. But,
Your mic.
I don't know. Oh, can he hear us?
Yeah, here it comes.
Here he comes.
Okay, even better. Great.
Okay, so for those who, since he didn't speak into a mic, Mr. Doling is willing to help us with literally anything we need he can provide. So along the lines, I assume, of what we've been talking about.
I'm not sure if Alexis, if you've heard the commercial. The Philadelphia has a commercial about at least I know it's on the radio, a mother talking about how and TV, that she talked the obesity problem in Philadelphia, and that she had taken her teenage son or daughter, I don't remember, to the doctor and with diabetes, and her big issue was the drinks. And I'm not sure where they got their data, but you might be able to get some additional data, because they were talking about soda. The two things that they brought up were sodas and juice on their ads. So you might be able to get additional information from, I'm sure it's probably the Philadelphia Department of Health as another resource for your, to add to your
Oh, sorry. Wait, if I turn mine on, does it like turn yours off? Or, oh, okay. Sorry. Okay. Yeah, I'll look it up on YouTube and try to find it and, use that information.
Maybe that's something to consider for the future, but I think, some radio thing. But I think our print, let's also try and get the print thing done. I talked with a graphic artist who I've used for a lot of things, and basically what he said as far as printing, unless we can get a township thing or a school thing, and I mean, really for our purposes, either doing something graphic in black and white or just what things look like off a color printer might really be sufficient. But if we want sort of higher quality printing, I understand that Kinko's is relatively expensive because part of what they market is quick turnaround, which isn't really exactly what we need. But the fact you walk up, you get it. That's part of what you pay for there. Printers generally would want a minimum of 50 copies, which may be more than we're looking to do. So we may be kind of stuck with Kinko's or a printer, if somebody has a contact with a printer that would just do, digital copies for us, fewer than 50, but we may want 50, I don't know, but, and that the sort of the price is going for a poster, let's say, I think it's 11.5 by 14, so like this size, not gigantic, but that kind of in-between size is going to be around $1 a copy. It's just as a sort of ballpark. But as I, really graphic, sometimes black and white can be very effective. And, that might be good enough. Or, as I say, just even running it off a home colored printer might also be good enough.
I just had a quick question about that campaign, and it sounds like this is the campaign that's based on the New York City campaign, showing distances between famous sites, which I think is very effective in New York. Alex, when you polled your classmates and the teen students, is it relevant for them to know the distance between 2 points? I only ask because I don't see a lot of kids walking around. I do see college kids running, and I think a lot of people use the gym and do exercises maybe at home or in groups. But my only question is, before we embark on a campaign, is this the most effective, relevant information for them? Would that be something that they can relate to?
Yeah, I think they can relate to it, and they're pretty location savvy because most of them have lived here for a while, so I think they know where everything is, and I think this will really help them to see, wow, okay, so I drink a cup of orange juice and I have to walk 1.3 miles from the gym to school to burn it off. So I think it would be a good way to show and make people aware about this issue. Okay, great.
I don't see us as being limited to this, but this was just sort of an easy thing. It caught my attention seeing it from New York. I thought, wow, wouldn't that be great to make it local for other areas, and why not our area? But I think we're all, definitely would like to do more on this issue since it's, such an important health problem and contributes to so many other health problems. So feel free to, express ideas or whatever, so.
Well, I was also taken with the project, especially as we reviewed the material and information from New York City, which has really gone into this in a big way, apparently. My problem right now is I'm not really 100% clear as to what the next step is going to be. You mentioned 50 posters. I know we've talked in the past about postcards. Who are the target audience for those postcards, and can you get this information on a postcard? I'm just not clear that what it is we want to do, so that we can put a price tag on what we want to do, and then see if the township and the school district, perhaps jointly, can come up with the bucks to make that happen. And I do want to go that route as a joint project, because I think it's something that affects the health of, has the potential to positively affect the health of school kids.
Well, we could talk about that now. I mean, I guess just personally, I would see sort of middle and high schools in the township, both public and private, as being places either through the, administrations have, see if Mark Skellinger will, because it's one of, a student in this high school doing it and the Board of Health doing it, if he'd be willing to sort of be a lead person in getting this to other schools, or getting it up to the superintendent and having her, distribute it to other schools, schools throughout the district, or maybe going the school nurse route and getting the school nurses to distribute it, but, and just posting them in places that get a lot of foot traffic in the schools. I mean, that's sort of I guess what I was thinking of. I don't know what other people think, and Lexa, what do you think?
If I could add something too, the radio station in the high school, as far as using that medium, and of course, I think we already talked about doing something on the Radnor TV. And then talking to some of the pediatricians or the family medicine practices that see the kids, as far as putting the posters in the practices. So again, hitting as many different places where the kids are going, and maybe talking to Starbucks, which I'm sure will be extremely happy for us to tell the children or teens that how much exercise you have to do. I mean, Starbucks tells you how many calories are in those drinks. So I don't know. I mean, Starbucks is usually pretty forward on projects. So as far as doing partnerships with different groups. So, I mean, it would be something that, as the Board of Health, that maybe we could, approach them about.
Herb, could I give you a little feedback? Two things I might suggest. The township's now doing that newsletter quarterly, so you could do an article and get it in there. Many years ago, before we actually opened the Radnor Trail, the parks folks had developed a street trails map, which then never went any further, but you might want to get in touch with Tammy Cohen, who's the Director of Parks and Recreation, and see if they can resurrect that, because that would be another positive thing. And as far as the amount you're talking for printing, I certainly wouldn't let that delay any work on this project. You're not talking about significant amounts of money.
Just to chime in as well. Also, you mentioned the use of Rad TV, which is the TV station we have at the high school. That station's, has some really state-of-the-art equipment right now. So if we want to get the information out to a captive audience at the high school, that might be certainly a way to do it and do it, pretty cost-effectively. Again, to reiterate, the cost of printing is not expensive, although not many locations have access to color copiers. So the Pennsylvania Department of Education, of which I receive a lot of things from, oftentimes what they'll do, they will create through a production department, which you mentioned, a document that would be sent as a PDF to various stakeholders in the community. Our public schools we have a little bit more control over. Our private schools we really don't. Short of that we have a nurse goes in there, so the nurse could hang it up in their office, but the nurse doesn't own that office. So when that nurse leaves, they could certainly take down that document if it does not prescribe to what they want to have in their school. And to send it to the headmasters, the principals of those schools, and give them the option. As the board, you created the document which has research behind it and has efficacy, and it adheres to the norms and the values of the community. But then to share it with the public as a downloadable document, perhaps on the Radnor Township website. I know, go here, download this document. We have a few color copiers in Radnor that we're discouraged really to use a lot of because they're very expensive to make a copy, about $1 a page, which isn't a lot, but when you're talking about thousands of copies, it really adds up per year. So that might be a way to take a look at it, because you could probably put something akin to a PowerPoint on Rad TV, which could just be rolled, which could be ran, continually during various parts of the day. So I think the use of technology, especially because of our kids are using so much technology, and there may be a way to, utilize different forms of media, Facebook accounts. Does the Board of Health have a Facebook account? I don't know. But these are the things that the kids are really on. And if the focus is to reach the kids, then I think we need to start thinking kind of like a kid. They might not really notice a sign in a coffee shop because there's dozens of signs in coffee shops for tutors, for lost dogs, for a variety of things. So I really think, and with Alexis being at the high school, and as a teen, she probably has a lot of creative ideas in which we could use. So we might want to just sort of think outside the box for this.
Would you introduce yourself again, please?
Yes, sir. Mary Ann McCarthy, good evening. I think that's a great idea, Mr. Kane, running it through the high school TV so the kids can see it, and on the Radnor station. I also, if that were agreed upon for the middle school with our administration, they have our announcements run through lunch on TVs. So it could run through something like that. But I'd be happy to work with whomever is working with Alexa. And when you get a full plan together, so she has some way to move forward, whether it's but some concrete. But I also agree with the posters that Mr. Kane was saying up. Sometimes they may not read them, and then they become unattractive or whatever. So the idea is to move forward and get the kids moving. And I'm sure that there's something at the elementary schools we could do if we had the connection, that we had actually a plan and an idea rather than just, speaking off the cuff and came up with this and, get everyone active, K to 12. So great ideas, great, I think it's a great start, but we need to develop it as a group and get direction and permission as far as where we can go with the school district, but I do believe they want everyone active. So thank you very much, and thank you, Alexa.
I guess the point would also be as far as getting someone, because especially when you brought up the elementary school, is what would be the best way as far as for the students to learn this, as far as bringing it in to the different programs, especially into the elementary school, is, how, what is the best way to teach them? I mean, it's like adult learning. Everyone learns in different ways, and visual and listening and things like that. So how is it best to teach the children, the teens, the middle school, that as far as how many different people we would need to involve? I'm not sure if that was what you were trying to say too.
Thank you. Is it on? When the board has a plan, and we could develop it for all grade levels, because there will be different needs at each level. You're not going to reach the little kids on Facebook. So it would have to be but children do love to move. So we could do it somehow, if given the permission by the administration, and they want to work with the Board of Health, which I'm assuming they certainly would. But I think we have to, you as the leaders, have to develop the plan and to move forward, so that it's not something in theory on paper, and just we want to get the action, not like, isn't this great, the Board of Health did this and you gave Alexa a project. She's a bright girl, we don't need to give her another project. She wants to get something going. So I think we can, but I think it has to be not in this public forum, but maybe just a small group, whomever, one or two, Alexa, and say, okay, how are we going to reach the high school kids, whether it be a Facebook account, whether it be the elementary that we do in a different way, and the middle school through their announcements in the day, or Let's Get Moving Day, or one of those things. Little kids just love to move, so I don't think that's going to be a problem at all. But we just have to encourage that. And if there's anything I can do.
Thank you for that last phrase.
Did I just say something I shouldn't have said, sir?
No, you said something I was hoping you were going to say. But your professional field is health education.
Yes, sir.
And I know that means you know more than I do about how to teach health matters to young people, especially. And I, for one, would welcome you as part of the planning team that gets us from where we are right now to getting the message out there, because you can help us figure out the best way and the most effective way, not just the cheapest, but the most effective way to do that, so that young people learn from the experience.
I'd be happy to.
Okay.
But in a subgroup, as opposed to...
Yeah, and that would be with Dr. Leader and Ms. Wishner. You've heard the people.
I mean, just to sort of remind us about this specific thing. Okay, so we know obesity, one of the leading health problems in the country, and in Pennsylvania, about a third of adults are obese, both in the country and in Pennsylvania. About 16 to 17% of kids, school-aged kids, are are actually obese now, latest school data. So a big contribution to that is sugary beverages and sugary drinks. And to some extent, we're taking advantage of, the research that the New York City Department of Public Health has done about effective ways to advertise this. So in a sense, we don't want to reinvent the wheel, and especially because we don't have the resources that they do in terms of market research, advertising. So they devised a marketing campaign to, addressing the issue of sugary drinks, which really affects all ages. And so, we're trying to just localize that specific thing for Radnor Township. I mean, I would see some advantages to, the kind of things that you're talking about, Alexa, of taking, I would see quite similar to what New York City did, of a sort of a chart. This is the drink, this is how many calories, and then sort of showing an example on each thing, maybe have one that highlights a Starbucks beverage, one that highlights orange juice, one that highlights Coca-Cola or whatever, to say, there are this many teaspoons of sugar, that means this many calories, and that means if you have a can of Coca-Cola, you need to walk from Radnor Township High School to downtown Bryn Mawr, or whatever the distance is, and showing it on a map. So, and I would see, using that, I think trying to figure out some ways to utilize that in the schools to educate the kids. I was also thinking it might be a good thing to, I think the PR department of the high school would love to showcase your work on this project, and maybe getting, something in the local newspapers to educate other age people. There's no special reason for it to be limited. Sugary drinks is a big contributor to obesity. I think we're interested in kind of a larger campaign and a sort of get moved, get active, and the other things that contribute to obesity: screen time, physical activity, diet, choices about eating out, family meals, the importance of family meals, and other things that we know, evidence-based things that contribute to obesity and that contribute to decreasing obesity. But let's not lose sight of just this one specific thing, which takes advantage of all that and is a sort of, we want to keep your project doable and make it happen. I think in terms of that, the next step is just to meet with, you have the data, and you said that, which is terrific. So let's make the product, and let's get the product out, and, sort of along the way, keep thinking in these bigger terms of, obesity prevention measures for the community at large and other things in the schools. But, I don't want to lose sight of this, getting this specific thing done and out, because it's very doable.
Yeah, I agree with that. That said, I think we need to bring this discussion to a close. I think we've heard some ideas tonight about how to do that. And there are ways that may be different from the way New York City is doing it, and certainly we are somewhat different from New York City. For one thing, they have a whole vast Department of Public Health there that we don't have. So we are going to depend on people like Kevin Kane and Marianne McCarthy and others to help us with this project. And I think that's a good thing, because the more we engage other segments of our community, the better off we are. So again, and my need is to look to one lead person, and I'm looking at Dr. Leader for that. Can we reasonably expect a report at our February meeting with regard to what it is we're recommending doing, and some sort of price tag on that? Doesn't have to be down to the nearest penny, but somewhere close to what we think it will reasonably cost to do it.
Yeah, I mean, Alexa and I, we can keep working together, and Amy, and help you start to develop what the maps would look like, and we'll work with Mr. Doling again, and we can try and get those on maps. In terms of pricing, I've heard a lot of things that are not costly. I mean, are we thinking PowerPoints in the township newsletter and things like these in media, lunchroom television, or are we thinking posters, or are we thinking postcards?
That's I think the subject of your report. It's what you're thinking of.
Well, I think, does any of the group have any final thoughts on what would be most appropriate? I mean, should we get some estimates on posters? What postcards?
I think it would be good to look at everything and to work with Marion as far as the best way to disseminate the information, given the age of the group that you're trying to reach. And I mean, the other thing too is something that Amy kind of brought up, Ms. Wishner brought up, is that if we're talking postcards that we're going to be sending out, handouts, I mean, because the other thing too is that we're focusing on the teens and the middle school and the elementary kids, but if they're also bringing stuff home to the family, then we are starting to hit the larger audience. So I know Dr. Hazen wants to stop this, but so I don't want to start bringing anything else up. But I just think at this point it would probably be good just to look at everything and then include Marion into the discussion and just bring all that to us and not just bring everything and bring it all back.
I think for sure one thing we need is a PDF though that can be emailed. Yeah.
Hold on one more quick second. What can we do with Alexa is work on some samples for next meeting of different text words on it, different phrases, different ideas, and we can look at them all and yay and nay and go from there.
I'd be happy to meet with you and Alexa and Ms. Wishner, if that's how you want to do this separate from this group, so we could brainstorm. If you just email me, I will do with a couple times. I would certainly be amenable to do that and facilitate Alexa's. So just let me know. Before I leave, I would and you're on teen health issues, if you're finished with that, may I have permission to tell you what went on today in Radnor Middle School? I think it would please the board. I just wanted you to know, due to your interest in the anti-bullying program, that we started round 2 at Radnor Middle School today. Every student has a lesson every quarter, and we concentrated in a week. So the whole school is receiving a lesson. There are different lessons for 6, 7, and 8. But at a later time, I will be glad to address the specific issues. Today's 7th grade lesson was on cyberbullying and the masks we wear and how it's so much easier behind a screen or text or whatever. And we went through all of that. It's co-taught with a guidance counselor or a principal. So we had great lessons, and the 6th grade lesson was about the cafeteria and what goes on in the cafeteria. So wherever you have the large groups of children and minimal amount of adults and things that can go on. So we went through all of that, and it was a very active class, and they're so honest. But I want the board to know that Radnor Middle School is working very hard, very committed. And if you go onto the school district website, it gives you a little bit about the anti-bullying program. And at a later time when we're doing other things and I don't have to scoot out of here, I will be happy to answer any other questions. But I thank you for your time, and I certainly appreciate all you do for our township.
And thank you for coming to these meetings.
Thank
you. Speaking of the bullying, it's not on the agenda, but I should mention the Alliance for Safe Kids, which along with this Board of Health and the Radnor High School, was a co-sponsor of the cyberbullying program at the high school last month. Is having its next meeting tomorrow at 11 o'clock at Radnor High School in the guidance office. I will be there once again representing the Board of Health, and we'll report back in February. Is there any further old business that wasn't on the agenda? I want to move to new business, and I know Mr. Nagel, did you mention that you had some stuff you wanted to bring to us?
You may have heard there's a group that's come to Parks and Rec and EAC. I don't know if they came before Board of Health to talk about the use of Roundup.
They did.
Okay. I've asked Parks and Rec to work with you and the EAC and the township staff and develop a position. I've had lengthy discussion with Public Works folks to understand why they use Roundup. So, I mean, if it was up to me, I'd just say don't use Roundup anymore. However, there are economic reasons to use Roundup. So, and there's also a lot of, as you find with all these issues, there's really disparate views on whether it's safe or whether it's not. So I would like to be able to make that decision more from a position of an educated position. So I'd appreciate if someone from your board could work with those other folks.
What will be the process? Are they going to contact
Parks
us?
Board should take the lead, and I'll remind them of that. I asked them at their meeting last week to do it.
Okay, that hasn't
Really
been done yet, so.
Now the group that came and talked to you actually met with Public Works last week. So again, it's a matter of us having the information. Back many years ago when I was on Parks Board, I spearheaded the effort to do away with use of chemical herbicides, pesticides, and fertilizers. And Radnor was a real groundbreaker with the use of organic programs on our fields. And at that time, we stopped using Roundup. Somehow we worked back into it. So that's why I'm especially interested in it. A couple other things I wanted to ask you about. I've had several complaints in my ward about folks burning wood, and that smoke from wood, comes into other people's houses. We do not have any ordinances about that. So I would appreciate some feedback from this board as to whether or not we do need that or whether it's just a minor nuisance. I've talked to Larry about it also. He thinks there's some national model codes. And then the last item is deer. In the past, it seems like we're always talking about deer more from the cars hitting deer type argument rather than the epidemiological issues, which is I know personally several people in my ward who have Lyme disease. So the question then becomes, and I'd look for you to feed this back to me and the board, is whether or not this is becoming a bigger problem, and do we have to be more aggressive about deer control? And then two pieces of update news in case you hadn't heard. One, at the meeting last week, we approved the licensing of the plot at Skunk Hollow for a development of a community garden. And that effort's going to be led by a group that's formed called the Skunk Hollow Community Farm. And they're going to have, I believe it's 50 plots in there that'll be available for minimal rent. So if you watch the Township scroll, there may be flyers out here, I'm not sure, but they're going to have an organizing meeting early in February. So I think that's really positive for the community, not only about, the locavore issue and using organic food, but also it's those kinds of things are very good for community. They really bring people together, and you get to meet people you have never met otherwise. And then the last thing, there wasn't a lot of fanfare about it, but an electric charging station for automobiles was installed over behind the Presbyterian Church. So that, I think, is a very positive start. I was hoping we'd do more than one, but one's a good start, so that we're moving more to help get Radnor's footprint down. And that's all I have.
Thank you. Just to recap, I think there were 3 issues that you want some feedback from us on. The use of Roundup, the Parks and Recreation folks are taking the lead on that, and they're going to contact me, I suppose, and start that process. We'll try and get you some information about if there are any ordinances with regard to burning wood, and what those ordinances might be. And
Not just are there any ordinances, but do we need an ordinance?
well, I think I'd like to, personally, my starting point would be if other townships have felt the need to have an ordinance, then maybe we have that need. But if in the absence of anybody else doing it,
We're not going
yeah,
to invent it.
it's hard to see, but we can look at that. And with regard to Lyme disease, I think Dr. Donato would probably, unless he disagrees, be our lead person on reporting back to the commissioners on that issue as to whether or not we're seeing more of it. I can only report that my own dog has been on antibiotics for Lyme disease for the last month.
Just a point of information that Chester County does a very good job of tracking Lyme disease cases. Obviously, without a true Delaware County Board of Health, that's probably not happening as much in Delaware County, though I'll be happy to talk to Dr. Betty about starting something like that. But Chester County has year to year, you can get your exact numbers of, reported cases of Lyme disease and see how the year has gone in humans. I don't know about in animals. But comparatively from 2010 to 2011, the cases of Lyme disease were relatively stable in Chester County.
Do you
Yeah,
have anything
and
from your practice that you would add to that?
Just on a personal experience, I mean, my practice is in Chester County. We see somewhere in the range of 50 to 70 cases of Lyme disease a year. Probably half of those are laboratory confirmed. The other half are probably clinically diagnosed, which is appropriate in pediatrics and probably in adults too. So the cases of Lyme disease are steady in this area, and I haven't seen much of a difference, considering I know 2 years ago there was a big deer cull in Valley Forge Park. There hasn't been a big difference.
Yeah, getting back to, I would welcome your follow-up with Dr. Vedian. I know I have had conversations with him about Lyme disease as well, and we had reached a point where he had two persons whose names I have at home but not with me, who are more expert than he, or certainly I, and we were moving toward trying to establish a conference here in Radnor on the issue of Lyme disease. And that hasn't happened yet. But please, if you...
I have one comment about that, and it's interesting. I almost feel like these are two separate issues, because the deer tick, the one that transmits Lyme, should maybe be called the deer, rabbit, squirrel, mouse, any rodent, skunk, raccoon tick, because they're all part of it. So unfortunately, the deer, while a part of it, are not necessarily primarily responsible for the transmission. And it becomes hard to say we're going to control all of those animals, because they do really, rabbits in particular, squirrels, are big carriers of the tick. So it's going to be a challenge.
Of course, the other issue is possibly prevention, and what maybe we need to get some information out to folks in Radnor Township about what they can do to keep themselves from, and their children and their pets from possibly getting it, although it's harder with pets. They don't wear socks.
Yeah, actually, some studies show that is protective clothing is hands down the #1 way to prevent Lyme disease over any other method. So again, I think this comes down to education again, but something we can certainly talk about.
Okay, anything, and again, Mr. Nagel will be getting back to you on these matters. Okay, any other new business?
Just something I've found of interest in the last couple of weeks. There, considering the child molestation allegations at Penn State University, a lot of questions from children in the area for my practice, and as far as my own children, just an interest in this subject of what the school district, Radnor School District, does for the elementary school children for teaching about good and bad touches and things like that. I wanted the board's permission to start to look into that a little bit. Lower Merion School District has a very interesting program where they have the children and the parents actually go together for meetings at certain times and get some lectures and information. So it sounded interesting. One of my friends who's a parent in that township has attended and liked the program. So with the board's permission, I think is it okay if I look into that?
Please do. Thank you.
And I'll report back to you.
I had two brief things about emergency preparedness. One is there is a Delaware County Medical Reserve Corps orientation meeting Tuesday, January 31st, 6:30 to 8 p.m. at the Delaware County 911 Center. Alexa, I'll give you this piece of paper. 360 North Middletown Road in Media. And for more information or to RSVP, that would be to Ed Klein. So that's EKLINE at icdc.com. So this is part of the Federal Medical Reserve Corps.gov group. And secondly, this area, the 5-county area, is the recipient through a grant to Drexel University of a national sort of pilot project on pediatric emergency preparedness. And so there's a subcontract through Drexel to the Pennsylvania chapter of the American Academy of Pediatrics, and I'll be working on that grant with Dr. Esther Chernak, who I formerly worked with at the Philadelphia Department of Public Health, and she's now associated with Drexel University. And so we'll be doing some focus groups and trial runs and drills and a lot of getting information from and trying to network with pediatric practices in the 5-county area. So not so much, I mean, it's a liaison work with hospitals, but the idea is to really think more about the pediatric practice part of this and how to do, what's really required in terms of pediatric emergency preparedness. A lot of emergency preparedness has not dealt adequately with the pediatric issues, the different physiology, medication and dosage issues, the whole thing about needing to track patients and reunite families with certain types of emergencies. And so anyway, I'll keep you posted as this project gets involved. It's a 1-year project for this year of 2012. And as I said, is supposed to have lessons for other places in the country.
By the way, on that topic,
Thank you.
the township is forming the next CERT class. Starts in February. It'll be on the 2nd, 9th, 14th, and 16th. And that's Community Emergency Response Team. And they can call and talk to either Sergeant McGuire or Sergeant Flanagan, and their extension 293 and 188 here at the Township Building.
What were the dates again?
February 2nd, 9th, 14th, and 16th.
Thank you.
Okay, any other new business? Hearing none, the meeting stands adjourned, and let me announce that our next meeting in February will be on Tuesday at February 21st at 5:00 p.m. in this room. Thank you.